And welcome to our Heart Month segment with Thomas McDowell. We're so glad to bring another segment to you. I know this has all been very informative. Thank you, Thomas, for coming and helping us out with this from a pharmaceutical or pharmacy perspective. We were talking earlier, chronic disease, diabetes, and high blood pressure, all of these things can lead to heart disease, heart problems, can it not?
Absolutely. So we were kind of talking about the big picture view, and on the preventative side, we've got to be thinking about all the different disease states. Just going back to our last segment, two of the major precursors to heart disease are high blood pressure or hypertension, which is extremely common, and then type 2 diabetes. And if those disease states are not effectively managed, you're putting yourself at higher risk for heart attack and stroke, and that is basically the definition of heart disease. Or, if you have a heart attack or if you have a stroke, you now have essentially heart disease, or it can also lead to heart failure. And that is mainly due to the effect that those disease states have on your heart and the blood vessels and circulation.
Right.
It's a very interconnected system in the body. And so on the hypertension side, that increased blood pressure is really causing your heart to have to work a lot harder than it normally would like to work, and also puts a big strain on blood vessels as well. And so that's a big precursor. And so we talked about some of our pharmacy services where we can help with the remote monitoring and the medication management, because just because you have those disease states does not necessarily mean you're going to have heart disease, but it does increase your risk just by having them. So, for me, when I'm thinking about heart disease, I'm going back to the preventative.
Yes.
And it starts now. If you're 25, 30, you are not invincible.
Right.
You need to be thinking about what your future looks like.
Right.
And genetics play a proponent in this as well.
When we're young, we don't think about that. We just don't think about it. But you're right. Prevention needs to start. I don't care how old you are. Prevention needs to start now.
I would rather see my patients prevent having to even get on blood pressure medications or diabetes medication. And high blood pressure sometimes is not necessarily preventable, but typically type 2 diabetes is almost, and I'm talking type 2, not type 1. Type 1 is an autoimmune disorder that we really still don't know why it happens, so it's not really preventable. And it occurs typically and is discovered at an earlier age. But type 2 is driven by diet and lifestyle. Some genetic proponent too can make you more likely, but typically still preventable for most patients. I don't want to say every patient, but it all starts with lifestyle and diet. Everything with your health starts there. We are meant to move. We are not meant to be sedentary.
Exactly.
And we're meant to eat healthy, fresh, natural foods.
Absolutely.
And we live in the United States where that is not our lifestyle.
Yes.
We are fast, we are processed, we are non-perishable. So when you talk about those items, they're not good for your health. They're just not. They're quick, they're convenient, they last a long time, but if you go to other countries, everything is sourced from your local produce stand.
We were talking about that the other day. Why are we fat here and they're not when you travel? Those people over there are not.
There's definitely a lower rate of obesity in other countries, and a lot of that is from the lifestyle, and things are put right in front of us that are just not healthy. And and you put a plug in on the just earlier about the farmers market. I love going to the Nash farmers market.
Oh, I do too.
And seeing all that fresh food and vegetables and fruit. It just came out of the field or the garden. And so some wonderful products there. My wife and I love going. And so I really like to start at that point. preventative is so much easier to have preventative
Yes.
maintenance than trying to fix something after it occurs.
That's
And so we're not invincible. And so with blood pressure, that can be a little harder to prevent than type 2 diabetes. There's a stress component there that maybe your job, you're stressed, or your life, you're stressed. It can be hard to control that. Fairly easily managed with medications. Lots of different classes, lots of affordable medication. There's the ACE inhibitors, the ARBs, the diuretics, the calcium channel blockers, so amlodipine, lisinopril, losartan, hydrochlorothiazide, a lot of affordable generic options on the blood pressure side. And so that's on the preventative side. And then on the type 2 diabetes, there's not necessarily a lot of medications that you're taking to prevent diabetes, but there are medications you take to lower your blood sugar. And there is metformin, for example, can be taken in the pre-diabetes stage.
Okay.
And so if you're in the pre-diabetes stage, your A1C, which is basically a measure of your past several months blood sugar on average, much better data than just taking a random blood sugar after you've eaten. That pre-diabetes stage is 5.7 to 6.5. And so if you're in that range, you still are able to try to prevent being diagnosed with type 2 diabetes, which is when you're over 6.5 A1C. Metformin is really the only somewhat preventative medication in that stage. It helps with insulin resistance issues. As your blood sugar rises, your body doesn't utilize the insulin as well that it still produces, and metformin can help with that. And so type 2 diabetes, if your blood sugar is elevated, switching gears from blood pressure to diabetes, if you have elevated blood sugar, it's a big strain on your circulatory system because that excess sugar is hanging out in the bloodstream.
Right.
Your body's not able to pull it out of the bloodstream and utilize it for energy. And so, that process kind of goes off the rails a little bit with handling the excess blood sugar.
Right.
And your body can really compensate for a long time, which is why I always say think about it early, because you will push your body to the limits, and then your pancreas that produces insulin will get worn out.
Yeah.
And so you have beta cells in your pancreas that release the insulin. The insulin pulls the blood sugar out of the bloodstream and utilizes it. Well, eventually your pancreas gets tired.
Very interesting.
So
after a while it says, I'm just tired, I'm just worn out.
And you really can't reproduce the beta cells when they're essentially go kaput.
Wow.
And so that you get too far down the road, it can be hard to completely reverse. But if you're in the pre-diabetes stage or even early diabetes stage, you can reverse it. You can reverse back into a non-diabetic A1C if you really
That's very interesting.
adjust your lifestyle and diet. It's hard, but you got to move, you got to exercise, and you need to eat well. And when we're talking about eating well on the diabetes side, it's low carb.
Yes.
And so that's the key there. Less processed, less carb, more protein.
Yes.
More vegetables. More, fruits do have sugar, but they're healthier than processed carbs. And so, but if you do get into the heart disease diagnosis, say you have a heart attack, and sometimes it's genetic. Some people produce more cholesterol.
Right.
And they can end up having a heart attack, and maybe they lived a pretty healthy lifestyle.
Right.
But genetically, they are more likely to produce more cholesterol, which can clog your arteries. It might not even mean that they're eating a lot of cholesterol.
Right.
It's just they are overproducers because our bodies naturally produce cholesterol. And then in your diet, you do add more cholesterol, usually from animal-based proteins. But if you have heart disease, you're typically going to be on medications like a beta blocker. And so metoprolol, nebivolol, carvedilol, or some drugs you might be on. They lower the heart rate.
Okay.
And reduce the strain on your heart.
Okay.
Because your heart's a little weakened from whether it's a heart attack, stent, or
Right.
heart failure, you need to reduce that load.
A lot of people, Thomas, tell me that if they're on heart medicine, they tell me they're tired. The medicine makes them tired. Is that true?
Absolutely. So that's typically coming from the beta blocker. I mean, a reduced cardiac output from heart disease in itself can make you a little more tired.
That makes sense.
And can make you short of breath. Especially if you have heart failure, the shortness of breath is a key indicator that your body is struggling to get the oxygen throughout the body, and can lead to fluid buildup and even a hospitalization, or what we call a heart failure exacerbation. But the beta blockers themselves, the drug, when you reduce that heart rate, that's what makes you feel tired.
Right.
Because if you're amped up and energetic, a lot of times your heart rate's higher.
Right.
You're pumping blood hard, you're energized, you're releasing a lot of oxygen throughout the body.
That makes sense.
But if your heart rate's lower, and we're trying to do that, we're kind of compensating through the drug to lower the heart rate, it can make you feel tired. Now, normally, your body adjusts to that new heart rate. And it's just like runners, for example, naturally have a low heart rate from all of the running, because their heart is just pumping so efficiently that it can get the oxygen out throughout the body at a lower heart rate.
Yes.
And so they might not feel tired with a low heart rate, but if you're newly going from 80 beats per minute to 55, 60 beats per minute, you will feel tired. So it's not necessarily the drug itself, it's what it does to the body. And so if you're just starting a beta blocker, that usually goes away after a few weeks. Now, what we're more concerned about is the lightheadedness and the dizziness if you're pushing that heart rate too low.
Okay.
So it is good to monitor the heart rate. In our remote monitoring program, we're checking on the heart rate too.
Okay.
And so
very good.
It's not necessarily, it's more designed for high blood pressure, but we see the heart rate, and so we do talk about that with patients, because if it gets below 50, it can be really dangerous.
Oh, wow.
And you can even, it can cause death if it goes too low, because you need it to pump to get oxygen throughout the body into the brain. And so there's a fine line there. You want to typically lower it with heart disease, but you don't want to go too low. And you don't want it to stay really high either, and be tachycardic, because that's putting unnecessary strain on the heart. So the beta blockers are super common after a heart attack or in heart failure.
Right.
We also typically see a cholesterol medication added on with heart disease, because there's often a cholesterol component or a clogged artery somewhere in the body that reduced the blood flow and maybe led to a cardiac event. And
if your cholesterol is always low, do you still have, I'm just thinking, so do you still have could you still have a heart issue? Even if your cholesterol is normal?
You can. It's not always necessarily a
not
clogged
always
artery.
Related to cholesterol.
Not always. Yeah. I mean, I would say a lot of heart attacks are typically plaque and cholesterol buildup, but not necessarily from diet and not necessarily from genetics. And sometimes it's hard to know exactly what the cause was. But usually, if you have to have like open heart surgery, they'll see the issue, or if you have to have a catheterization, they'll find the issue. Sometimes it might just be a weakened artery, and this delves a little bit more into, the cardiologist would have more knowledge on that than me, but it's not always a high cholesterol. It's not necessarily connected. So just because your cholesterol is low does not mean you don't need to have some preventative
if you have some
lifestyle
issues, you feel like some issues are going on, it's so important to get it checked. If
you do things that are a strain on the heart, if you take other medications like a stimulant or something, or for example, this would be hopefully not something that's going on with our listeners, but drug users, for example, or cocaine and drugs like that, really methamphetamines really amp up your heart rate and can cause long-term heart damage. And so that's a potential issue as well.
Very interesting. So we know some of these drugs, the beta blockers, we have to learn to manage. And that's where it's so important if you have heart issues or any diabetes or whatever, it's so important to work with your pharmacist. Work with your pharmacist because, yes, you may have some side effects.
Yeah.
And but you have to have the medicine. So you have to learn to manage.
Yep.
I mean, you have to manage.
Yep.
Learn to manage, how to manage.
And talk to, because it's a big step, because we see patients sometimes, and heart disease comes in many forms, and it's one of the biggest killers in our country. I think it's the #1 killer of women over a certain age.
I think
and it's
so.
right there at the top of the list for men as well. And so it's something that a lot of people will deal with. And so trying to prevent it best you can is really key. And medications can help manage it, but we see patients going from no meds to 8 meds if they have a heart attack.
Right.
And a fluid pill, a beta blocker, they usually are on lisinopril or something in the ACE inhibitor blood pressure realm, because there's data showing that can help with heart disease. And then they're on cholesterol medication and maybe another blood pressure medication, and so it can be a big burden. And so
what if you miss your medicine? What do you do?
Yeah, so if you miss it and you remember it in time, you can still take it. But if you're getting close to the next dose, you would not want to double up. Never double up.
Okay.
On specifically most medications, you would never double up. And so it's better to just, if you miss it, you miss it. Don't miss it too much.
Right.
And I also didn't mention a blood thinner. Most patients are on a blood thinner if they've had a heart disease, because a lot of the heart disease issues or events are caused by a clot. Right. Not always a plaque buildup, but sometimes a clot can cause an issue, and the blood thinner helps lower the risk of that reoccurring. But lots of side effects, interactions with all these drugs. And so, talk to your pharmacist about it. We can help you wade through it. We service a lot of patients coming out of the hospital here locally post-heart attack with blood thinners. And it's that we'll see people coming from out of town and they just happen to be here and have a heart attack.
Wow.
And so it's a scary time.
Yeah.
And so prevent it best you can. And, I'm big on protein and non-processed foods, healthy foods. There's a lot of folks that steer away from the red meats, but I think it's more of a moderation thing. Mm-hmm. And I think if you're active and you don't necessarily have a big genetic proponent to have high cholesterol, that personally I'm okay with some red meat and protein throughout the diet. It's more of your lifestyle and processed foods. And
we've always heard anything in moderation. Just in moderation. So that's a very good point that you make. So in closing, is there anything else? What if you, and I had this happen with a relative, we were on vacation. What happens, and it's vacation time, summer's coming, what if you you get to the beach, and you say, I left my medicine at home. What do I do? Here I am in Lord knows where.
Yeah,
what do you do, Thomas?
Happens all the time. The best thing to do, if you're not near your regular pharmacy, and hopefully there's a pharmacy nearby, there's typically a pharmacy within 5 miles of most areas, but if you're able to get to a pharmacy where you're at, you would go there and ask them to transfer your prescriptions from your normal pharmacy down to where you're at. And as long as there's refills on them, you can do that. Okay, good. And now what you might run into is if you just filled it at your normal pharmacy through your insurance, and then a week later you go to another place and you left it, your insurance is not typically going to pay for it again that soon. Right. Now, some insurances have overrides that you can put in, vacation overrides, but they don't like to do it because it costs extra money out of the insurer's pocket. But there's always the cash option if it's generic and cheap. But if it's a brand drug, it can be a bit of a pickle.
And you're not going to have to pay but for a few, because you're not going to be there forever.
Yeah, so you would just want enough to get you through your time. So if you don't know what to do, period, call your local previous pharmacy, especially if you're using independent. We'll walk you through the process, because it happens all the time. Okay. So we'll transfer stuff back and forth. Then after you come back, we can transfer it back, and you can't transfer Schedule II controlled substances like narcotics and pain meds.
Right.
But you can typically transfer anything else with refills on it.
So don't panic.
Yeah, there's usually an
panic.
option
No problem.
we can work with you on, and we can guide you through that.
Well, this has been very informative. It's very important for us to do these things. We always do a big thing on American Heart Month, and we're carrying it over this time because we've had lots of guests come in and help to inform you. And I hear from you all the time that you like that we're doing this, and you do stay informed. Our audience does feel like they stay informed. So we appreciate all of the docs in the area, the pharmacist, Thomas, everybody that helps us put this together to inform you. That's why we're doing it. Thomas gives great. This is a part of Medical Park Pharmacy's customer service to you to come here. Thomas comes here when he needs to be in his pharmacy, but he comes here to do this for us, and we really, really, really appreciate it.
Thanks, Sandra. I enjoy it, and if I can leave the listeners with two things, if you're wondering where to start to prevent heart disease or better manage heart disease, diet and exercise. Diet and exercise.
If you have a desk job, get up every few minutes, get up and just take a walk. Some people say, well, I have a desk job, I sit all day.
Walk at lunch, lunch
break. Yeah, get up on your break, your lunch break, whatever, but move. Like
right.
Thomas said, just important not to be sedentary. So, and diet, you're so right, diet.
Absolutely.
And work with your pharmacist. They can really help you. So thank you, Thomas.
Yes, ma'am. Thanks, Sandra.